We will talk about runny nose. Runny nose is a very common condition for any person. It's excessive production and drainage of mucus from nose, from nasal cavity. Now let's say, what is the most common cause of runny nose? Runny nose is also known as rhinorrhea, and most common cause is flu and cold. 40% of cases of runny nose are because of common cold and flu, most commonly common cold. In 25% of cases, allergic rhinitis is responsible on rhinorrhea, and around 15% of cases is because of sinusitis. Now let's say how we can differentiate this rhinorrhea is because of allergy or because of common cold. When there is allergy, rhinorrhea starts immediately after exposure to allergen. So this reaction is immediate. And in case of common cold, rhinorrhea starts gradually. It requires around a day or two to start rhinorrhea and to become more prominent and more severe. In case of allergy, rhinorrhea is immediate. And duration also different. In case of allergy, rhinorrhea can last for several weeks or several months, sometimes whole year, because of allergens. For example, if person has allergy on indoor irritants such as dust mites, he or she can have allergy whole year. It's possible. Most commonly it's for several weeks or several months. In case of common cold, rhinorrhea lasts only several days. And composition of rhinorrhea also different. In case of allergy, we have clear and watery rhinorrhea, and in case of common cold, it starts with a clear, watery rhinorrhea but becomes thicker and opaque after some period of time, and it becomes more yellowish or greenish in time. The more greenish or yellowish is the discharge, it more indicates bacterial involvement. In case of viral infections, usually it's more clearer. Discharge from nose is more clearer compared to bacterial infection. Also, symptoms are different, allergy and common cold. In case of allergy, we have repeated sneezing, itchy, watery eyes, dark circles under the eyes. It is called allergic shiners. You can see it's allergic shiners. It's sign of allergy and allergic rhinitis. And in case of common cold and flu, we have body aches, fever, sore throat, and general weakness and malaise. This is main differences. Most commonly, rhinorrhea is caused by rhinoviruses. Rhinovirus is most commonly responsible on common cold cases. So majority of cases of common cold happens because of rhinoviruses. And now let's say how we treat and what is mechanism. The mechanism of rhinorrhea is dilation of blood vessels to the mucous membrane of nasal cavity, and it increases blood vessel permeability, and fluid from blood leaks from blood vessels, and we get the mucus. Also, mucus production is increases, and it's stimulated by allergy or viruses. Both cases, it's stimulated by inflammation. Inflammation is main component, but in case of allergy, main component is histamine release. Histamine causes dilation of blood vessels and inflammation, and in case of common cold, it's more complex. Histamine also plays a role, but it's much more complex, and it stimulates immune system and inflammation also, and we get rhinorrhea in both cases. So main mechanism is vasodilation or dilation of blood vessels, and that's why we have treatment which targets this vasodilation. For example, we have pseudoephedrine, which is oral decongestants, and this pseudoephedrine narrows blood vessels. That's why it can decrease rhinorrhea. Also, we have nasal spray, oxymetazoline, and oxymetazoline also narrows blood vessels, constricts blood vessels, and we get improved rhinorrhea. But we should be careful in case of using nasal sprays, especially oxymetazoline causes rebound effect, and rebound effect means that if you use it for several days, more than 5 days, and when you stop using it, you can get congestion again. It's a rebound effect. So we should be careful on nasal sprays, especially oxymetazoline, not to use it more than 3 days. In several cases and special cases, you can use them for 5 days, but usually try to minimize using oxymetazoline for 3 days. Oral decongestant also you should use carefully, pseudoephedrine, because it can cause anxiety and irritability and insomnia and increased heart rate. So it has its systemic effect, and you should be careful on pseudoephedrine also. So if we say what is effective against congestion and rhinorrhea, oxymetazoline is effective, but it has rebound effect. That's why you should be careful. But also we have ipratropium bromide, and for watery runny nose, watery rhinorrhea, ipratropium bromide is best solution and best treatment because it decreases mucus production. It has less side effects. So even oxymetazoline is considered as a classical treatment and first line treatment in many cases. Ipratropium bromide is also effective and with less side effects. So we should consider ipratropium bromide if person has rhinorrhea primarily. It can also cause dryness of nasal cavity, so some side effects, but it's unimportant compared to oxymetazoline, and oxymetazoline can cause rebound effect. So we should be careful. Also, oxymetazoline causes dependence. So if person starts using it, he cannot stop it easily, and he needs more and more dosage, increased dosage to get same effect, and it also causes dependence. That's why we should be careful on oxymetazoline. Also, we have very safe alternatives. It's saline nasal sprays. This is water and salt. This water and salt solution is safe, of course, but it's not such effective as ipratropium bromide or oxymetazoline, but you can use them for long term. Also, antihistamines are used to relieve rhinorrhea, such as cetirizine and loratadine, fexofenadine. You can use them if there is primary component of allergy. If we have histamine, increased histamine, and we have watery type runny nose, where increased histamine level is important, you can use these antihistamines, and they have some effect, but they are not considered as first line treatment of runny nose. More specialized and more classical first line treatment of runny nose is oxymetazoline and ipratropium bromide. Also, saline nasal sprays are very common, and because of high safety and for long-term usage, so person using them successfully. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.